Good afternoon. My name's Dr. Hume Rendle-Short, and I'm a GP in Toowoomba. And I'll start off by saying that I'm a GP who over the last 5 or 10 years probably has developed an interest and quite a significant patient base in the whole area of drug and alcohol management. And that's what I want to talk about today. And I want to talk about my pet hate. And my pet hate is a little animal called Xanax. Xanax or Alprazolam, otherwise known as Karma, or the other trade name is Karma. And I just want to explain my view on this and why and what I think is going on. And I will preface this by saying that I've been to, with my interest in drug and alcohol, been to a number of meetings, etc., where Xanax or Alprazolam is discussed, and these views are shared by the majority of drug and alcohol clinicians. So, Alprazolam, you're probably aware in Australia that earlier this year, February 2014, that Xanax itself became unavailable. The company that produces Xanax stopped it, so we now use a drug, or the alternative is a drug called Karma. And you might also be aware that at the same time the government relisted it as an S8, which means that you have to, if you're prescribing it, you have to obey all those laws. I am firmly of the belief that they didn't go far enough in doing that, and as you're probably aware, Alprazolam comes in 0.25s, 0.5s, 1s and 2 milligram tablets. PBS listed authority 50 tablets with 5 repeats. I personally am of the view that they should have stopped the 2 milligram tablets on the PBS, and also that they should have stopped the repeats, and they should have brought it really much more into line with the other benzodiazepines. So what is it about Alprazolam, and what makes Alprazolam such a interesting and scary drug? And it's really to do with the punch that it gives, the speed of onset, the short duration of onset, and the massive punch, the strength, the potency of the drug. So what's Alprazolam meant to be used for? Theoretically, it's meant to be used to stop and abort a panic attack. So it's meant to be used, and it's listed for panic attack disorder where other treatments have failed. So it's meant to be used to actually switch off, in a PRN sense, to switch off a panic attack. And when you think about it, if you're a drug company designing a drug that's going to do that, you would want something that comes on quickly, that has a lot of punch, and that doesn't last very long, because panic attacks only last for half an hour or maybe an hour at the very most. And that's precisely what they've manufactured, a drug that does that. Unfortunately, when I, as a doctor with an interest in drug and alcohol stuff, when I look at the addictive potency and nature of illicit drugs and drugs that are abused, the ones that are abused and that the abuser likes, that the addict likes, are those that are rapid onset, big punch, and short acting. So it fits that bill entirely. So what do I mean by a big punch? What do I mean by a powerful medication? And I often, during a consult, will go to what's called the benzodiazepine conversion charts. It's very quick. You just Google it up. You go benzo conversion, and for me, it's sort of ready to go. For purely convenience, I use the site that's at the top of the page, which is benzos.org.uk. And there's no, it's easiest, that's the one that comes to the top of the page. I've looked at the various other sites, and while there is a small variation, because these are all based on clinical judgment, the sites basically say the same. And what might surprise you if you look at these sites is that 1 milligram of Alprazolam is equivalent to, let me just double check this, to 20 milligrams of diazepam. So when you give a patient a 1 milligram Alprazolam dose, you're giving them a short, sharp punch equivalent to 20 milligrams of diazepam. Let me just give you some scary stuff about that. So When I take on patients, say for methadone and with opiate addiction, etc., and some who come in specifically for benzo addiction, it's not that uncommon to come across patients who are on 2 milligrams TDS of Alprazolam, have been for a long time, prescribed through the PBS system, 50 tablets with 5 repeats, and they're just giving it to them. So 2 milligrams TDS of Alprazolam is equivalent to 120 milligrams a day of diazepam, which is, as you can probably work it out, that's equivalent to 24 tablets of diazepam. So that's what I mean by the manufacturers have built a drug that has got a good punch. And it's hard work, and these guys, these patients, are truly addicted. So we've heard the problems that sit around, or in the late press we've heard the problems that sit around people who, high-profile people who have OD'd on Alprazolam, who Alprazolam has caused sort of erratic and bizarre behaviour. I guess I'm also saying that there are many patients who can't go through a day without their Alprazolam, just like I have other patients who can't go through a day without their heroin or their OxyContin. A truly addictive drug. It's interesting when you go to some of the drug and alcohol meetings, the common theme is, as soon as a new patient says that they're on Alprazolam, the doctor groans and says this is going to be a difficult case, because it adds to the confusion and to the erratic behaviour of the patient. And because it's so readily available, it is very hard to control the use of that. So in a word, I hate it. I certainly instruct my registrars that they don't prescribe it unless talking to me. I probably have 3 patients on it who I inherited on it and who we are attempting to go through a weaning process, which is another story in itself and which is a difficult process.